Welcome to everyone who is joining. We will just give a few minutes for other colleagues to join.
Very good. Happy to see you.
Very happy to see you too. It's wonderful to see we've had a lot of people register for this event, so we want to give good time.
I can see that. Very good.
Welcome for everyone who's joining us. We will just give us a couple of minutes for those that are joining for others to join. Wonderful, welcome. Well, I'm sure we'll have a few more colleagues, friends, supporters from around the world joining us over the next few minutes. We have a full agenda to get through today, and so we're very pleased to commence this very important meeting. My name is Alicia London. I'll be chairing this event for us today, and I'm delighted to be here. I've been a mental health advocate, I'm an advisor at Prospera Global, and founder of United for Global Mental Health back in 2017. And for too long, Mhps has not been a prominent role within discourse or political discussion. This is starting to change, and we can see that evidence by the many who've organised today's event and those that are attending. And so thank you for all for joining us. This meeting is particularly important, occurring on the margins of ECOSOC, and I'd like to begin by acknowledging and thanking today's hosts and organisers. Today's event sponsors are the governments of Mexico, the Kingdom of Morocco, and the Kingdom of the Netherlands, and has been co-organised by the International Committee of the Red Cross, the International Federation of the Red Cross and Red Crescent Societies, the Office for the Coordination of Humanitarian Affairs, Save the Children, UNICEF, and the World Health Organization. Any form of migration fundamentally implies a redefinition of individual, family, group, and community identities, which we know can put stress on those individuals and the communities around the world. And as we consider the devastating impact of conflict in people affected, mental health and psychosocial support should be considered as critical, even life-saving, as we'll hear, I'm sure, from many of our panelists and discussions today. Today's event, looking beyond 2022, what can we do to better for the health of migrants and advance GSM commitments, couldn't come at a more important time. COVID has led to an increase of awareness about the importance of MHPSS and the needs of MHPSS services in humanitarian settings is particularly acute. Today, we are thrilled to be joined by experts from regions, global organizations, those with lived experience from all over the world, many of which I want to acknowledge have been working on this for a very long time. And all of us are coming together to look to the future for solutions and learn from one another, particularly as we come into this event and as we look to recover and adapt at a time of COVID-19. We need to share best practices to strengthen health systems and utilize, importantly, the UN in New York as a mechanism for increasing political will to ensure mental health is seen as just as important as physical health. Mental health is health, and we all know this, including the work of the General Assembly and the high-level meetings on UHC. That's why we're all here today. Thank you for joining us. As we kick off, I'd like to just go through a few housekeeping pieces. Firstly, to say this, as you'll see, this event is being recorded. And for the format of the event, we have 90 minutes. We'll begin with opening remarks from our sponsors and member states. We then have an interactive panel where we'll hear from our experts from around the world, following by a question and answer section. We have about 45 minutes for question and answer, so there should be good time for interventions and questions. We want to make sure that those who do want to ask questions can do that. And so we have a mechanism for that and how that will work. If you have questions, they're welcome throughout the whole event in the chat box, so you can put them in there. And if you would like to take the floor during the question and answer time. We have about a minute for an intervention. We would encourage substantive questions to the panel during that time. We'll get to more of that when we get to it. So now, to commence our proceedings, we would like to begin with opening remarks from our co-sponsors. We have the Deputy Permanent Representative of Mexico, Ambassador Alicia London. We have the Deputy... I'm sorry? We'll continue. We have the Deputy Permanent Representative of Morocco, Ambassador Omar Khidiri, and then ECOSOC Ambassador of the Netherlands, Ambassador Sarah Hoffersman. And so to begin, we'd like to hand over to you, Ambassador Buenrostro from Mexico.
Thank you very much, Alicia. It's a pleasure to be with you. Can you hear me well, right?
Yes, we can hear you.
Okay, very good. So I'm very pleased and very happy to be with you this morning. It's a very important meeting and very timely as well. Mexico is grateful to have been invited to co-sponsor this timely event, as I was saying. We want to thank the event organizers and our fellow co-sponsors for continuing to build on the momentum we have gathered on the issue of mental health and psychosocial support services in humanitarian settings. Dear friends, doing more and doing better when delivering Mhps services is an urgent task that cannot be understated. In March of this year, Mexico hosted an area formula meeting on access to mental health and psychosocial support in situations of conflict, post-conflict, and humanitarian settings. I am glad to announce that the chair's summary of this meeting is now an official UN document and can be found under symbol A/76/854. The speakers at our meeting provided an increasingly worrying panorama that will continue to arise if we neglect the mental health needs of people experiencing distressing situations. As of now, organizations on the ground document that only less than 15% of people in humanitarian crisis who suffer psychosocial distress have access to the care they require. This fact alone strongly calls for the critical need to increase access to mental health and psychosocial support services, including access to psychiatrists, therapists, and other experts in the field. Again, this is an opportunity where the United Nations system and member states can work more closely together and better. While the UN can play a considerable role in incentivizing the deployment of mental health professionals to emergencies, member states can do more to incentivize more people to enter this field of study. This includes providing the right tools and training to all the professionals and future professionals in the field of Mhps. In addition, mental health is not an isolated task, but a part of a comprehensive notion of care. As the concept note for this event rightly states, the global scale of mental health needs poses a development and humanitarian challenge, often exceeding the capacity of national health, social protection, and education systems. Moreover, ensuring these services adapt to local contexts and cultures with the close supervision of relevant professionals remain a priority. Not only that, but these services must account for diversity factors and support those living in rural and remote areas. In this regard, we're incredibly pleased that last year's ECOSOC Humanitarian Affairs resolutions included strong language in terms of providing and funding cross-sectoral mental health and psychosocial support services that are of quality, contextually sensitive, and provided with respect for human rights. This language was further strengthened in its sister resolution within the margins of the General Assembly by accounting for gender-sensitive services. Providing mental health care must also go hand in hand with challenging gender and other stereotypes, respecting disability and other factors of diversity. Now, we also need to push for language that recognizes the imminent link between mental health and climate change and other global environmental threats, and call for the delivery of climate-focused mental health services. Promoting this type of language will also contribute on raising awareness on the humanitarian situations of environmental catastrophes. Before I conclude, I would like to take this opportunity to share the next steps in Mexico's advocacy strategy for more efficient access to Mhps services. Later this year, we will circulate a call to action to be launched on the margins of the events held to commemorate the World Mental Health Day 2022 for the member states to endorse. Then, we also plan to introduce a thematic draft resolution on mental health, sustainable development, and peace in the General Assembly. We count on all of your support and meaningful participation in this innovative draft text, which will help cement long-term efforts to promote Mhps under the Universal Health Coverage Agenda. I thank you and I wish you all a fruitful discussion today. Thank you again.
Thank you, Ambassador. And thank you especially for not only highlighting the importance of mental health and psychosocial support, but also outlining your very practical next steps with a very clear action for those attending to consider supporting. Now, thank you very much. Now we'd like to turn to Morocco. Ambassador Kidri, over to you.
Thank you very much. Thank you for giving me the floor and for this extremely important meeting. Of course, at the outset, I would like to join my colleagues of Mexico and the Netherlands, as well as the other co-sponsors, in welcoming you to this side event aimed at renewing, advancing, and promoting our commitments towards comprehensive approach to mental health and psychosocial support in a humanitarian setting. In the same vein, I would like to thank ICRC, IFRC, OCHA, UNICEF, WHO, and Save the Children for convening also with us this timely meeting in the margin of the Hajj week, and expresses in advance Morocco's appreciation to distinguished panelists for the time and engagement. We look forward to hearing their briefings. The Kingdom of Morocco fully supports the SG's policy brief entitled COVID-19 and the Need for Action on Mental Health, launched in 2020, that has sent a strong and clear message on the importance of mental health. In this regard, Morocco is equally committed to promoting physical health, as well as addressing the consequential related stress and fear affecting mental health and well-being of individuals, especially those in humanitarian settings. Ladies and gentlemen, as part of the Moroccan National Immigration and Asylum Strategy, adopted in conformity with His Majesty King Mohammed VI, humane vision on the issue of migration and asylum, Morocco has adopted a national strategic plan on health and immigration 21-25 that is consistent with Morocco's staunch engagement in favor of human rights and international cooperation to improve access of migrants and refugees to preventive and medical care services. This strategy has yielded tangible progress that benefited migrants and refugees, including access to primary health care for migrants, regardless of their administrative status, preventive and curative primary health care programs, as well as chronic diseases and mental health treatments, pregnancy, childbirth monitoring programs and family planning programs, school health programs and integrated childcare, including mental health care, national AIDS control program and tuberculosis control program, as well as integrating refugees and migrants in the national vaccination campaign against COVID-19 free of charge. This is just to tell you a little bit of what Morocco is doing towards migrants, towards refugees, to ensuring they have access to mental health as well as health services in general. Regarding the need for a comprehensive MHPSS approach, I would like to highlight two priorities. First, MHPSS is now widely understood to be relevant in conflict-affected areas and humanitarian settings where populations, in particular women and children, suffer from high degrees of trauma. There is an urgent need to sufficiently acknowledge and address the socio-psychological factors of need, trauma, and discrimination in the humanitarian context. Hence, the international community should redouble efforts to promote social cohesion, trust in institutions, and the overall effectiveness of humanitarian efforts. Second, member states should stimulate national efforts to address mental and psychosocial needs as fundamental for sustaining peace, respecting and promoting human rights, and achieving sustainable developments. On the other hand, the UN system should continue to galvanize efforts to include MHPSS more systematically in its humanitarian approach as an active actor on sustaining peace we will also continue to strive that the issue of mental health is fully incorporated in all the work that is done by the Commission, by the configurations, as well as by the UN Secretariat, to include that aspect in their mandate and in their work on the field. Finally, I conclude by reiterating Morocco's strong commitment in pursuing its engagement to the implementation to galvanize a broader support for incorporating the physical and mental health, including in humanitarian settings at the national, regional, and international levels. You can count on us, and of course, with the cooperation with our colleagues, the co-sponsors will continue to advocate and to engage in the UN here in New York, but also in Geneva and other areas for this objective. I thank you very much.
Thank you, Ambassador. I think it's very helpful to hear the prioritization of vulnerable communities. So thank you for bringing forward those for women and children, particularly in complex settings. And again, providing a very practical overview of your commitment and the work to integrate within UHC. And a very powerful message around essential for peace. So thank you very much, Ambassador. Now I'd like to turn to Ambassador Offermans of the Netherlands.
Thank you very much, Alicia, for giving me the floor. And it's a great pleasure to be here with the friends from Mexico and Morocco. Let me also thank IFRC and all the others for organizing this event. I'm going to try to be brief because I think we have a great panel, and I really want to have time to discuss this topic that is top of our agenda with the panelists as well. But let me start by saying there's good reason why MHPSS is still high on our agenda. And Alicia, you mentioned crises such as COVID, and now of course we also have the war in Ukraine that really increase mental health needs substantially and have made the importance of mental health more visible, but also better understood and more accepted. But we're not there yet, and it needs to remain on top of the agenda, simply because access to mental health and psychosocial support services increases resilience, and it increases the ability to cope and recover, both from individuals, but also from communities. So investing in mental health is needed, and it is smart. And that goes for all settings, but especially in emergencies. So how do we do that? I'm going to present 3 concrete ideas. First, let us all commit to fully integrating mental health and psychosocial support into our policies and into our budgets. It was mentioned before, in 2021, the General Assembly adopted the Humanitarian Omnibus resolution. And as the Netherlands, we really fought hard to make sure that the GA in this resolution asks humanitarian organizations and partners to integrate MHPSS in crisis response. Now, I think it's a time for full commitment and full implementation of this resolution. Secondly, we should work on tracking our investments and on tracking our efforts. Let's make good use of the IASC MHPSS monitoring and evaluation framework to aggregate information and evidence on the results of these efforts. And let us also learn from this evidence. And thirdly, strengthen preparedness and response capacity now and in the future. Being able to provide and continue mental health services and psychosocial support in all situations is crucial, but we do need to invest now. So far, the Netherlands has tried to do its part. As an example, we've invested in a rapid deployment mechanism, which provides MHPSS experts to humanitarian organizations on the ground, and which has already deployed experts to a multitude of crises. But there's much more work to do. At the 4th Global Mental Health Summit, hosted by Italy this coming October, capacities and skills for quality mental health and psychosocial support stand center stage. It will be an important moment for further integration of MHPSS in crisis response. Let's join forces to ensure that we indeed treat mental health the same as physical health. Thank you very much.
Thank you so much, Ambassador. And particularly want to thank you for calling forward the importance of investment and the very practical work that you've been doing and are continuing to do. The investment has been missing for so long, and it's incredibly encouraging to see that moving and having such support. So thank you. Thank you for interventions from all our co-sponsors for those opening remarks. We're going to turn now to our panel. This provides an opportunity to dig a little deeper into practices that are happening around the world and the commitments that our panelists have and are seeing around the world as well. And we're looking at both at a regional and country level and a global level. As we know, it's important to ground all of these conversations in the everyday realities of those who are living in complex settings, humanitarian settings, and are struggling with their mental health. And so I'm really pleased to open this discussion with a video. This video is from Mhps. She's a 17-year-old from Gaza, and she's the second vice president of the Palestinian National Children's Council. And this is brought to us, this video today, by Save the Children.
مرحبا، أنا اسمي مسك من فلسطين تحديداً غزة. نعاني نحن كأطفال قطاع غزة يومياً من انقطاع الكهرباء المتكررة، بالإضافة لتلوث مياه الشرب وملوحتها العالية، وأيضاً سوء الأوضاع الاقتصادية بسبب الحصار جعلتنا نعيش معاناة يومية من أجل توفير متطلباتنا الأساسية. كوفيد-19 كان حصاراً فوق ذلك الحصار الذي نعيشه منذ 15 عام، فمنذ عامين أعيش مع القلق والخوف على حياتي وحياة أسرتي بسبب كوفيد. أريد أن يعرف هذا العالم أن الحياة في غزة قاسية جداً على الجميع وخاصة على الأطفال، فلا كهرباء ولا فرص للعمل للكبار، وبالكاد تستطيع توفير أبسط مستلزماتك. هنا في غزة نتعرض لحروب وتصعيدات متعاقبة أدت إلى خسائر كبيرة وخوف وقلق لا يفارقنا. هنا في غزة قد تفقد منزلك بشكل مفاجئ بدون أي سابق إنذار، وإذا نجوت ربما تفقد عائلتك أو جميع ذكرياتك وأحلامك في هذا المنزل. هنا في غزة لا مستقبل لنا. كم أتمنى أن يتغير هذا الواقع الذي فرض علينا، فغزة بحاجة إلى الدعم لبناء ما تم تدميره خلال تلك الحروب، وما سيحسن صحتي النفسية هو علاج حالة الخوف والقلق المستمر الذي أعاني منه، ووجود أماكن للعب وتطوير القدرات، وما سيشعرني بالأمان هو عدم سماعي لأصوات الطائرات التي تحلق باستمرار فوق رؤوسنا. وما يبعث الأمل لقلبي هو رؤية الطبيعة من حولي كالأشجار والحدائق العامة بدلاً من رؤية مشاهد الدمار. أتمنى أن أعيش في مكان آمن بدون حصار، وأن أكون قادرة على التنقل وممارسة حياتي الطبيعية بحرية. لذلك أطلب من الأمم المتحدة أن تعمل بجدية لكي يحصل كل الأطفال على الأمان، وألا يكون هناك طفل خائفاً طوال الوقت من أن يفقد حياته أو أحبائه.
That's a powerful reminder. How a few technical issues is a very powerful reminder, and thank you to Save the Children. Please do pass our thanks on to Mhps as well for sharing her experience today. I'm really pleased now to introduce our panel. I'll introduce the panel in full, and then we'll turn to each individually. And as you've seen in the chat as well, there will be time for questions, so do feel free to put them into the chat box now as well. The panel we have today are extremely experienced and bring a really broad range. We have Stella Dermasanaidi, Mhps Program Manager at IOM in Bangladesh. We have Rania Hibri, PSS and Protection, Gender and Inclusion Program Manager at the Lebanese Red Cross. We have Milena Osorio, MHPSS Movement Coordinator at the International Committee for the Red Cross. We have Anne Wilhot, MHPSS Specialist, Child Protection in Emergencies at UNICEF. And we have Fahmi Hanna, co-chair of the ICRC reference group on MHPSS in emergency settings at the World Health Organization. To open our panel, we'll hear from each with brief opening comments. I'd like to turn first to Stella. Stella, the COVID-19 pandemic has not only affected people's mental health and well-being, but also the way they can access MHPSS support and other services. Could you share a little bit with us about the experience on the ground in Bangladesh, what you're seeing and what IOM has done, particularly in Cox's Bazar, to address the challenges that are arising? We're also really keen to hear a little bit more after hearing of your experience about how the community was involved in these processes and how this has changed some of the way you work.
Yes. Good morning or good afternoon from Cox's Bazar. Thank you for the question, Alicia. Allow me to start by explaining briefly the context for those who are not familiar with the Rohingya response. Here in Cox's Bazar, there are around 925,000 Rohingya refugees, and the area is also known for hosting the biggest refugee camp in the world. So since the pandemic started, several lockdowns took place in Bangladesh, and this hampered, of course, humanitarian access to the communities, both arriving and receiving. As IOM, we had to adjust our activities to the new situation, as group meetings were not allowed and the movements of the communities were significantly decreased. We started by implementing remote services such as hotline and telecounseling, and these services are active till today. We also had to find ways to widely disseminate information related to COVID-19, its impact on health, including mental health, and ways of coping. For this reason, staff and community volunteers started using bicycles and were sharing information through speakers with pre-recorded messages while moving around in the areas of operation. IOM also collaborated with Mhpss Action, and we created and disseminated audio dramas through local radio stations. In addition to all this, awareness sessions on COVID-19 were daily conducted in health facilities, including COVID-19 isolation and treatment centers in the camp area. In these centers, the Mhpss team was offering awareness sessions in the waiting areas where screening was taking place, information on how to deal with COVID-19 related stress, and admitted patients were supported with individual counseling, Toys for Children, PFA, and we were facilitating communication with their loved ones through calls or even video calls whenever it was possible. When the vaccination started, all IOM staff and volunteers were available to provide PFA and emotional support to those who were afraid of being vaccinated or were hesitating. And the team was encouraging an open dialogue with the community in order to normalize stress reactions, discuss myths and facts, and share reliable and official information. Regarding the community involvement, and as the engagement of the community is of utmost importance for IOM, community members were actively involved in the conceptualization of activities and material and their preparation, as well as in the dissemination of information. RCMC, so it stands for Rohingya Cultural Memory Center. It's a center that aims to preserve Rohingya culture. So RCMC produced videos created by Rohingya artisans, like songs and poems that community members wrote using traditional proverbs and traditional music instruments. These videos were widely shared on social media and screened in IOM health facilities. Now, as COVID changed the way we work, we would like to share some lessons learned, including the importance of having remote services for those who don't have access or when lockdowns take place. We also believe that Mhpss's mainstreaming and integration into health are very important to avoid discontinuation of services and ensure continuous support. This is actually what allowed IOM Mhpss to continue having field access during this challenging period, as we were part of the essential services package, and we were one of the few agencies in Cox's Bazar that maintain access for these services. So we believe that advocating for Mhpss as life-saving services is important for all actors. Lastly, COVID-19 reminded us of the importance of continuous capacity building, not only as part of response when we have critical events or situations like pandemics, but also as part of preparedness, including training for first responders, but also for the community, and communities most of the times part of the first responders. So that's all from us. Over to you, Alicia, and thank you very much.
Thank you so much, Stella. Again, for those very practical examples, we're really hoping that they will be practical examples that others can be taking away as well. So thank you. Really pleased now to turn to Rania from the Lebanese Red Cross. Rania, given your experience with MHPSS programming at the country level as well in Lebanon, how do we reach the most vulnerable? Could you share some examples of some scalable interventions, well-coordinated approaches that are particularly important in these settings that countries could replicate or learn from to improve MHPSS services on the ground?
Hello, Alicia. Hello, everybody. And thank you for your question. Thank you for hosting me as well in representing my national society. So let me just set the setting for you regarding Lebanon. I don't know if you know, but Lebanon is witnessing a lot of complex situation, a lot of crises that are happening all together. We had the economic crisis, we had the COVID-19 pandemic crisis, and lastly, we had the Beirut blast that I think everybody heard about. Looking at the situation that is very complex, we need to highlight also that the Lebanese Red Cross within our staff and volunteer are also from the affected communities. So they're not only service providers, but also affected themselves. Saying that we would like to highlight how much it's important for us to take care of our staff and volunteers in terms of mental health, and to acknowledge that we want them to provide the service, but also they are themselves affected. Saying that the Lebanese Red Cross have created a hotline to its staff and volunteers that they can reach out, and it's held by 7 psychologists, and a call is being done anonymously by them. And a service can be provided whether remotely or in person according to each situation. Free of charge, up to 10 sessions actually. Also, medication is available for our staff and volunteer if needed, as well as psychiatric hospitalization. Saying that it helped a lot our staff and volunteer to reach out for mental health services that is still stigmatized in Lebanon, unfortunately. And it's very costly in Lebanon. I can say that it's very costly as well in the whole MENA region. And now with the inflation, it's practically not accessible. We should also highlight that not all wounds are visible. Some of them are not visible and are impactful as much as a bleeding wound. Saying that, so this is what the Lebanese Red Cross have done to maintain a healthy retention of its staff and volunteer regarding their mental health, and also to be in alliance with the movement policy, the moment that I think one of my colleagues will talk about later on. So this is a priority where we would highlight our the mental health of our staff and volunteer. I don't know if I still have time. So that's it from my side, unless you have something that you want me to add.
No, I think that's incredibly powerful and clear, and we'll have some time for some questions. I'm sure there'll be some questions coming through. Thank you just for giving context to Lebanon, and also for calling out that policy. I might actually ask Milena to speak a little bit around the common policy that the movement shares between, I know it's between the IFRC, the ICRC, and 192 national societies as well. That has been a really powerful convening policy for this work right across the world. Thank you very much. We will turn to Milena. I might ask you just to add a little bit about that. I know that's been a huge one and really important one that many have been leading. So I'd love to hear a little bit about that, but also given your experience in managing and implementing Mhps programs worldwide, as well as ICRC's work in conflict settings, how can states support the provision of Mhps services in these particularly conflict affected countries from your experience and the experience of ICRC?
Thank you so much, Alicia. Good morning, good afternoon, good evening to everyone. So indeed, the ICRC witnesses on a daily basis the devastating effects of conflict in people's mental health. I think our teams in the field are always seeing how much individuals and communities are confronted to violence, disabilities, injuries, sexual violence, and forced disappearances. There are so many more I could mention. And at the same time, those communities are dealing with the practical, if I can call them that way, challenges of finding water and food, providing for their children, taking care, being displaced. this combination of things in the current nature of conflict, when we know that there is protracted conflicts and they are lasting an incredible long term, is very worrisome, because this means that people are going through an enormous, it's not one event, but many. And it's a very chronic situation, which is actually exacerbating a lot more the vulnerabilities of those communities. The other challenge I would like to highlight that we witness in our work is how much those people that are incredibly vulnerable also are falling into what we will call the treatment gap, right? So already health systems were scarce, but then due to conflict, they are actually severely affected, and therefore they don't run the same way. And so this means challenges in terms of accessibility, reduction of staff, reduction of supplies, and many other things, which are also then jeopardizing even more the access to already scarce services for populations that are really vulnerable. I would like to highlight what my colleague Rania said. It is indeed also a very incredibly important issue to recognize that the people that are serving others, so frontliners, volunteer staff, but also health workers, everyone that is helping is also from the same communities. And so they are also affected. For us, it's very important to acknowledge that international humanitarian law actually provides that persons in need of mental health services must receive the care they require. And it also protects persons engaged in delivering these health services and mental health and psychosocial support services. Now, without this, we cannot really ensure that people are being properly served. So to your question, and a bit about the policy, but I would also like to mention, Alicia, the resolution. You remember what we did at the 33rd Red Cross and Red Crescent International Conference in 2019 was really amazing. We managed to bring together all the states signatories to the Geneva Conventions, together with the Red Cross, Red Crescent National Societies, the Federation, the ICRC, and we managed to adopt a resolution where actually all these actors, and particularly the states, many of us with us here today, I would like to recognize also the support, for example, from the Netherlands government, the Mexican as well. So they have been incredibly supportive, and this is very commendable, but as Sarah said, there is a lot still that needs to be done. So what I would like to do, I hope I'm not extending myself too much, is bring in three issues that the resolution of the Red Cross, Red Crescent actually is already addressing and recommending states. And I'm hoping that this will serve to inspire states and actually illustrate the question that you asked me, which is so important. So three main aspects. I think one set of recommendations for states are related to health system related recommendations. Another set, it's about socio-cultural issues. And the last one is more related to advocacy and policy issues. So the first one is really about, we are urging states to integrate mental health into general health services. I think this was mentioned already. And this means full spectrum of provision of services. So from the basic layers to the more specialized, because people have different needs and require different services. This also means that in all emergency preparedness and responses, and if the COVID crisis has shown something is precisely this, mental health should be integrated as a priority, and it should be always considered as an important part of this. And of course, there is always a very important effort from the ICRC to support training of human resources and ensure that there is relevant geographical coverage, particularly in conflict settings, so that we take into account which people are being affected and how access is being impeded. The recommendations that are addressed to sociocultural factors are actually about, and I think they are very important, it's about, let's don't forget how important it is to integrate the community. So it's also a call to states to remember that community leaders, community workers, community sensitization, community awareness, sometimes they may sound like, you know, they are not the most important or the more specialized part of the intervention, but this is essential. We have the big challenge of address the reluctance of communities and people, individuals, to discuss and recognize emotional difficulties. And this is a very important barrier, particularly in conflict settings, because I would like also to highlight the importance to respect patient confidentiality. What we encounter a lot in the field, particularly in conflict settings, is people being afraid of talking about what they went through because they are fearing for their lives. And so if there is no patient confidentiality and no respect to this anonymity and privacy, it's very easy to find even more challenging the access to services. On this note, I also would like to emphasize, I think it was mentioned by some of you before, the diversity angle is very important. So taking and building up programs that are tailor-made for age, gender, diversity is very important. We really get concerned when we see a lot of copy-pasting, thinking that everyone can benefit in the same way. But in fact, it is very important to tailor-made programs to include diversity also in the programs that we serve. And finally, on this social-cultural input, I would like to say as well, it's very important we recognize the importance of culturally competent care. This is another very common barrier. And it's, I think many of us, when we go to support humanitarian emergencies, we think we can, again, copy paste a bit what has worked somewhere else. And it's not to say we cannot get inspired, of course, but cultures are very different. And if we want to be respectful of people's participation and we want to really ensure that we are successful, we need to respect these cultural differences. Here is also an urgent call to states to ensure that participants, communities and individuals are participating themselves. They have a plan, a space to actually work on policies, on strategies, and we are actually conducting and discussing these things with communities. And finally, just the advocacy related, I'll be very quick. This is about just an urgent call to say, please remember that mental health, it cannot be a secondary thought. And we are really inviting everyone to stop debating whether mental health is a priority. This continuous discussion with resistant parties is impeding progress. And I think we need to call for states just to become champions and make sure that Mhps is central in the agenda of donors, policymakers, and others, so they can really help us a lot to do that. Thank you so much.
Thank you so much, Milena. I think that sums up beautifully. This needs to be integrated into humanitarian responses. It's not to be debated, it needs to be done. And so with that, I think that's a perfect segue to hand over to Anne. In an emergency, mental health and psychosocial supports, the needs are so great. And we've heard some about today and really wide ranging. How can humanitarian actors know where to start and what to prioritize?
Thank you, Alicia, and thank you everyone for being here and for the important messages from my colleagues so far. It's really inspiring, really. So this is a really important question and one that we spend a lot of time with. Every aspect of a person's life can impact their mental health and well-being, and lots of different actors have a role to play. So there's been more and more recognition of the importance of MHPSS in emergencies. And at the same time, we've seen a wide range of MHPSS activities being implemented in different sectors. While these services are responding to a critical need, many actors, including donors and member states, have said that they need a lot more clarity on which MHPSS activities should be prioritized and how to make sure they're doing activities that are impactful and are of high quality. So to help clarify this, UNICEF, WHO, UNHCR, and UNFPA have worked closely together to develop the minimum service package for MHPSS, or MSP. It's a single intersectoral package of 22 priority MHPSS activities that should be available in all humanitarian emergencies. So no matter what sector they're from, humanitarian workers can refer to this core set of minimum activities when applying for funding, designing programs, and implementing activities. So the idea is to make the response faster, more evidence-informed, and better coordinated across sectors. For each of the core activities in the MSP, it gives you a little rationale of the activity, a checklist of key actions to implement the activity safely and effectively, and a list of tools and resources, and then also a list of budget items. So it's actually a really practical tool that everyone can use, whether you're implementing or planning or funding or making policy that allows you to act fast when an emergency happens. So we know that colleagues are finding it useful when they arrive in a new emergency and need to develop a program in a very short space of time. For example, we're using it right now to help us plan and prioritize MHPSS activities in our Ukraine response. And we also have colleagues that are using it to help support governments develop intersectoral mental health strategies in very different contexts, like the Philippines, Yemen, and Myanmar. So the field test version of the minimum service package is already available. Everyone here can go register at mhpssmsp.org. But we're also field testing some specific components at the moment in Iraq, Colombia, South Sudan, Nigeria, and Ukraine. We'll be revising it in the coming months and launching the final version at the end of the year. So we hope you'll join us for that as well. Working together like this across sectors, we think is really the only way we can effectively and swiftly respond to MHPSS needs in emergencies and truly do more and do better for mental health and psychosocial support around the world. Thank you.
Thank you so much. And also providing that really practical link, mhpss.msp, is that correct? Just for those who were listening. Yeah, perfect. Wonderful. I'm really pleased to move to our final panelists now, and then we'll open up for questions. Please do keep adding them into the chat. Really pleased to hand to Fahmi from the World Health Organization. For you, I'm the international level. As we look at the international level, what mechanisms exist to help strengthen MHPSS in humanitarian settings? Where are the gaps, and how do you see MHPSS fit into health system strengthening and also future pandemic preparedness?
Alicia, thank you so much. And I thank their excellencies, ambassadors of Morocco, Netherlands, and Mexico, as well as my colleagues from international humanitarian organizations for this important event. I think compared to a couple of years ago before COVID-19, we are definitely doing more and doing better with mental health and psychosocial support. But actually, we need even to do much better and continue to do more by investing more on mental health and psychosocial support at country level. You asked me about international support. We have the Interagency Standing Committee Reference Group, a very active group during the last 15 years, composed of all mental health and psychosocial support focal points from the Red Cross and Red Crescent movement, from United Nations agencies, from international NGOs, has been working very actively during the last 15 years to mainstream mental health and psychosocial support in international humanitarian structure, developing consensus-based, evidence-based mental health and psychosocial support guidance that are available in numerous languages. Some of these are available in more than 100 languages, and supporting country-level mental health and psychosocial support technical working groups. 2 years ago, we had 23 country-level mental health and psychosocial support groups in humanitarian emergencies. Now, we have, after 2 years, 56 countries with such active mental health and psychosocial support coordination mechanism. Thanks for new initiatives. For example, the Netherlands-funded interagency mental health and psychosocial support rapid deployment mechanism, which became really instrumental in emergencies such as the Ukraine emergency that affected also neighboring countries. We have during the last 2 years through the interagency rapid deployment mechanism for mental health and psychosocial support, 35 deployments at country level. Mental health and psychosocial support also start to have plenty of very good evidence-based interventions that are interagency, such as the minimum service package we heard from Anne just now, costed evidence-based interventions that will make in the next years mental health and psychosocial support more predictable at country level. We have also integration of indicators in global humanitarian plans, such as the Strategic Preparedness and Response Plan for COVID-19, and also the Mental Health Action Plan. We have now a mental health and psychosocial support preparedness indicators approved by all member states. I got the opportunity to travel during the last 3 months to do country support for large-scale emergencies, such as Yemen, Afghanistan, north of Ethiopia. And I found a common challenge facing our colleagues in those countries who are providing mental health and psychosocial support. Limited resources, diverted attention, huge gap between the needs in the countries and the available funds. And if this is affecting, in general, the humanitarian response in those countries, it affects much more badly mental health and psychosocial support. And when mental health and psychosocial support funding would arrive, It comes for 6 months. It comes for 1 year, which is not sufficient to replace the decades of neglect in this area of work. We need more predictable funding, more sustainable funding, longer funding to fill this huge gap in mental health and psychosocial support, which is cross-cutting in different sectors and area of work. Again, even during COVID-19, despite actually the fact that there was huge amount of advocacy at global level, when WHO made an assessment for continuation of essential healthcare services during the COVID-19 pandemic, in 3 surveys, we found that mental, neurological, and substance use services were the service reported most frequently as disrupted across all the countries during the survey. So I think, to summarize, there is no health without mental health, but also there should be no public health emergency response, no humanitarian response without mental health and psychosocial support. Yes, we are doing more. Yes, we are doing better, but we need even to do more and to do much better by continuing to do more and investing more in mental health and psychosocial support. Thank you.
Thank you so much, Tommy. We've heard a lot from our panelists, and we want to turn now to a question and answer interactive session. Just a few housekeeping reminders here. If you have questions, feel free to put them into the chat. If you would like to speak, we will be opening up for interventions for a minute. We'd encourage them to be a minute substantive interventions, no more than that, with a question, which would be fabulous. We'll do them in 2 or 3. If you would like to do an intervention, if you could include your name, role, and organization as well in the chat box. Okay, so feel free to move that. We'll be facilitating as we go. We'll take 2 or 3 questions at a time and then turn to the panelists. You can either direct your question to an individual panelist or open to the group. Our first question, I'm really pleased to open the discussion with the delegation of the European Union. Frederick Schutzia from the European Commission, over to you.
Thank you very much. Good afternoon and good morning to all. Thank you for a very interesting discussion so far, and thanks for giving me the floor. The EU considers MHPSS as an essential dimension of health, well-being, and resilience. So it's an important and integral part of our response to humanitarian crisis in a multi-sectoral approach. So we cut across health protection, including gender-based violence, but also education and nutrition. We feel that much more can be done in conflict and humanitarian situations, and especially capacity is often the main barrier to scale up MHPSS services, both for individuals and for communities. So capacity building at national and sub-national levels is essential for us. We also support the provision of quality MHPSS services, and its measurement needs to be strengthened. In that sense, we are a very strong supporter of the ongoing piloting of the minimum service package as a good example of minimum standard setting in the field. As was mentioned earlier also, or echoing what ICRC said, we urge the UN and all humanitarian actors to ensure high quality MHPSS services, taking into account the local context and culture. We heard also from the intervention from Lebanon how important local actors are in this area. Our question to the panel would be, needs are huge for MHPSS and resources are limited. What would be, in your view, the top MHPSS priority on which the international community should focus now to increase efficiency? Thank you very much.
Wonderful, many thanks for that. We'll take another question and then come back to the panel. So I'd like to turn to the colleague from Thailand, who's first secretary of the permanent mission.
Good morning, colleagues. I hope you can see me and hear me. At the outset, I would like to thank Mexico, Morocco, and the Netherlands for their leadership on MHPSS, and also for other organizers and panelists in sharing your valuable experience from the ground. Thailand views mental health as an integral part of the right to health and also for realizing universal health coverage. And we hope to see MHPSS being prominently featured in the discussions in the lead up to the high-level meeting on universal health coverage in September, including in humanitarian contexts. We are also happy to hear about the initiative being led by Mexico on the upcoming call to action and resolution on MHPSS, and you can count on us for the constructive engagement in those processes. processes. So moving to the questions, we have two questions for the panelists today. First question is, how do we scale up the good and innovative practices that were implemented in humanitarian settings or even during the COVID pandemic, like providing remote Mhps services? This is what Thailand has also done during the lockdown, like using technology, social media, and community engagement. But how do we maintain these good innovations to be available more broadly, not just in temporary context? Some speakers has talked about the challenge of maintaining Mhps services in the long term, and how do we integrate them into the universal health coverage scheme in the long term? My second question is that how do we also ensure that the mental health of humanitarian workers, health workers, volunteers, and other frontline workers are also taken care of? As we've heard reports during COVID-19 that frontline workers are faced with more stress, and this must be particularly true for those in humanitarian settings. So those are my two questions, and thanks again for this very useful event.
Thank you so much. And for that commitment around joint action, it's, I'm sure, greatly appreciated. We're going to have one more question and then we'll turn to the panel. I'd like to turn to Werner Obermeier of the WHO.
Good morning, Sarah. Do you hear me?
Yes, we can hear you. Please go ahead.
I'm not sure if you can hear me. There
Yes.
seems to be a connection problem.
Oh, I'm so sorry for that. We'll just put into the chat so everyone can know that we can hear. A moment.
I'm sorry, there seems to be a connection problem on my side.
No problem. Oh, there we go. We can hear you.
Oh, there we go.
There we go.
Thank you so much, and sorry for the delay. I just wanted to congratulate you and all the sponsors for hosting this fantastic discussion. It's certainly very topical in the world we live in now. And as we recover from COVID, I think we will realize more and more that the mental trauma accompanying this pandemic will far exceed the costs associated with the virus itself. So certainly an investment that we must be making. And here in New York, we very much look forward to working with Mexico and other like-minded countries in taking forward a General Assembly resolution and a call to action to focus on Mhps in the years ahead. So thank you once again, also specifically to Mexico and the Netherlands and Morocco for their wonderful words up front.
Thank you so much, Werner. Okay, we will turn to the panelists now to the two questions. I think we'll take them in two. So one, I might actually call to you, Anne, first. You've talked about the minimum service packages, but really specifically, what are the top priority? What's the top priority in a humanitarian setting from the EU? I think this, so the second question from Thailand, how is a very practical one. How do we scale up the humanitarian practices that emerged during COVID? Specifically looking at tech, and secondly, how do we ensure, how do we really support those frontline workers? So over to the panel. Right, we could start with you, Anne, and then other panel members are free to jump in.
Hi, Alicia. Anne had to step away, so I'm happy to cover this question. Hello, everybody. I'm Zainab Hijazi. I work with UNICEF as well, and as a colleague of mine. So thank you so much for that really important question. And Anne, was able to really kind of outline the minimum services package and the intention through which it was developed. And it was really, as she said, is to really prepare and create a package of services that are really critical to be rolled out in the early stages of an emergency, but also in protracted emergencies. So when we talk about, well, what are the priorities? What should we be focused on? Ultimately, if you look at the minimum service package, we highlight those 22 activities, and they really kind of focus on interagency coordination and assessment for the MHPSS response. So how do we ensure the humanitarian MHPSS response is well coordinated and responsive to the context, needs, and gaps? And so we would need to ensure coordination across sectors and ensure that from the start, we are assessing the MHPSS needs and resources to guide our programming. We heard Milena talk a lot about, not coming in with prepackaged set of tools. We need to be able to tailor and adapt MHPSS programming to the needs of the communities we are serving. As well, we need to be looking at essential components of all MHPSS programs, which means we need to, from the start, also look at caring for staff and volunteers who are providing MHPSS support, supporting MHPSS competencies of staff and volunteers. And of course, this includes safeguarding the different entry points for MHPSS care. This means that we need to be supporting the capacities and competencies of health workers, as well as education workers and staff and teachers and social workers, and also volunteers who are coming from within the community, ready to support and to be supported in order to provide the best care possible. Also, we need to be looking at MHPSS program activities that center around how do we ensure that humanitarian actors and community members are oriented to MHPSS and equipped with the basic psychosocial support skills. And of course, this includes training for frontline workers. It also includes strengthening self-help and providing support to communities. And this could include disseminating key messages to promote mental health and psychosocial well-being, supporting community-led MHPSS activities, providing group activities for children's mental health and psychosocial well-being, supporting caregivers. I think a lot of the times in the early onset of emergencies, we're very conditioned to respond to the immediate needs and forget that persons, children, and also individuals more broadly are centered within a broader socio-ecological model. So we really need to be looking at programs that support the individual as well as the caregiver and the communities within which they reside. And ultimately, as well, we must not forget that we need to be, as part of our essential services, providing focused support for those people who are impaired by distress or mental health conditions. And this means we need to be providing mental health care as part of general healthcare services, and also as part of clinical care for survivors of other very specific groups, vulnerable groups like survivors of sexual violence and intimate partner violence, and also really be able to ensure that we are responding to those specific needs, as well as ensuring referral pathways across the different interventions that we are setting up. So those are a very quick overview of some of the core activities that we would implement and the priorities. However, please do go to the Mhps site and also check out the detailed list of those activities and how they were broken down, but also costed, so that we're able to really understand what are the most cost-effective activities that we could be implementing in emergency settings. Thank you, Alicia, back to you.
Thank you so much, Zainab, for a very practical overview of the minimum service package. It's fabulous. Okay, I would like to call Fani. I know Fami needs to leave a little early, so over to you for answers on the questions. How do we scale up interventions that have been developed during COVID? Is something I'd be really keen to your thoughts on, and any other question you'd like to respond to.
Alicia, thank you so much. I would like to complement the very good answer by Zainab on what are the priorities and how to deal with the situation where we have limited resources on mental health and psychosocial support. I want to share the example from Ukraine. Ukraine is currently working, in fact, on a priority set of multi-sectoral mental health and psychosocial support actions to do currently during the war, and also preparing for the recovery phase for years to come, to use the momentum now and attention to mental health and psychosocial support to build back a better mental health service even during the war. But actually, the priorities set by Ukraine can be different from the priorities set by neighboring Poland, from the priorities set by Hungary. If I answer a short answer for what the priorities should be, the priorities definitely should be in investing in services. But the priorities in every country need to build really in good quality needs assessments and to be aligned with international standards such as the minimum service package and the interagency standing committee guidelines and tools. And to deal with the limited resources in the area of mental health and psychosocial support, we need to remember that it's not only the mental health and psychosocial support actors that need to contribute funding to this area of work. Health sector, for example, when they procure essential medication in general, need to remember that part of this need to be essential psychotropic medication. Actors within the protection sector, when they provide protection for the community in general, need to include people also with mental health condition and integrate mental health and psychosocial support within protection and child protection and gender-based violence responses. I think the real challenges with resources for mental health and psychosocial support is that we limit it to resources allocated specifically to Mhps and forget that it needs to be allocated by every sector and every cluster as an integral component of their funding requests and their activities. Thank you, Alicia.
Fabulous. Thank you so much. Turn now to Milena. We have seen that in the past, the recent WHO report just released last week really provided some great examples of how in complex settings there have been systems that have been built off the back of what was developed during that time. There are some really great examples in that report for those looking for others, but I'm curious from your perspective as well, how can we build that really great question, how can we build upon those that were developed during COVID to be integrated and long-term solutions and not just in those crisis moments?
I would be, very idealistic in saying, I think that a lot of us practitioners and humanitarian workers learn a lot ourselves, because indeed we had to use all this tool and technology to be able to reach people during COVID, and it wasn't easy. But I think that actually we face a lot of the taboos that many of us had in front of, is this really possible, no? And is it helpful? So I think that in itself is a very good lesson learned that will stay with us for a long time. And as you said, that's why there are very good examples in the WHO report. I would like to mention for us in the Red Cross, Red Crescent movement, we are currently working in implementing a roadmap after the adoption of the policy and resolution I mentioned before. And we have different working groups where we have several national societies and other participants meeting to work on particular topics. One of those working groups is actually currently working on doing some sort of a research project to find out what was used more during precisely COVID in terms of digital interventions and tools, and what is going to be more helpful and more accepted by communities. So this is, for example, I would encourage people to work on this kind of initiatives, once again, asking the people themselves what was more helpful for them and what really was good. But I would like also to take the opportunity, Alicia, to say that from a perspective of the ICRC, we're also very concerned of the people that can definitely not get benefit from this innovation and these tools, because this is fantastic. It sounds great that we can reach a lot more people, etc. But there are people that do not have this means of telephone or internet or others. And I would like to say that still the humanitarian proximity remains a very important priority. There is a lot that is actually done by being in contact with the people. So what we actually tried to do was to maintain that contact by respecting, of course, all sorts of social and important measures for prevention. But I think that's also a very important message. No, let's don't put one over the other, because this proximity is very central to help the people that need us the most. Thank you.
Thank you so much. Rania, I might call to you on the question around how do we support those really critical frontline workers at the forefront of humanitarian response, mental health support. We lost Rania. She was just here. No, does any other panelists wish to comment to that? We've just lost Rania.
I can help Alicia, but I don't know if anyone else. I think, you know, as I mentioned, right, for us, volunteers, staff in general, I would say frontliners, we have actually programs called Help the Helpers as well, that you may remember. We have talked a lot about this. It's very important to actually never forget that we need to support the people that are providing the support. They are victims themselves, suffering from a lot of these needs. And at the same time, they have to also listen and constantly being exposed to hearing the stories of others, etc., which is a very challenging job. I would say this also as a psychologist, because we all know that psychologists are the first ones that need some sort of supervision to be able to actually provide this. So I think it's our duty is to make sure that wherever we are, I would say even at home, but wherever we are, wherever we work, we need to make sure that there is a policy, a strategy to work on these issues, that they are not neglected, and that actually the people that we work with have the possibility to express how they're feeling, that they have a system that guarantees also anonymity and privacy to actually express how they are feeling, and that every one of us is committed, right, with our teams and the people we work with to provide this support to each other. Training for manager is something as well that we are trying to do a lot in the Red Cross, Red Crescent. It's very important that people that are coordinating big teams in humanitarian emergencies and things like this are also sensitized to what is this, how to identify the problem and how to have proper measures. No? So it is really a collective responsibility. Some people may think it's about hiring 4 or 5 psychologists and telling the people, here's their phone number and you can give them a call. But in fact, it's a lot more structural, right? It's how we work together, how we are more sensitive to the feelings of our colleagues, and how do we create spaces where it's okay to talk about these things and they are not seen as weaknesses, and we support each other. So this is the kind of ambience that we would like everyone to foster, right, in their own environment.
Fabulous. Thank you so much. We have another question having come in. I just want to encourage all participants to submit any other questions into the chat box, or let us know with your name, title, and organization if you'd like to speak. We've got a question come through from Carmen. Carmen, would you like to come on and ask your question? It's again about how do we continue to strengthen systems post-COVID, but would love to hear from you.
Thank you so much, Alicia, and really great to see you, to be here, and to hear these amazing contributions from our panelists. Thank you so much. Yeah, I think the question is very connected to other comments that have been made, and how we all have witnessed this increased attention to MHPSS. Our colleagues in different emergencies have been having to put together more effort on top of the existing emergencies. And I think we talk a lot about the increased visibility, and I wonder if there are key lessons learned that we think this is going to be an MHPSS and COVID momentum, or how can we make it? How can we take these actions, this increased work on MHPSS, and keep the momentum, keep things going, and the attention and the resources after COVID as countries transition, but still encounter as many issues as Rania was mentioning, and yeah, as the other colleagues. So yeah, I guess the question is around keeping the momentum on MHPSS and making it a beyond COVID concern for all of us. Thank you.
Thank you so much, Carmen. We might skip straight to the panel. Stella, I'm not sure if you have a response on this.
Yes, thank you, Alicia. Thank you, Carmen. I believe that with the multiple losses that we witnessed or experienced, the lockdown and on the impact that COVID had on our lives and our mental well-being, it became clearer that mental health is indeed a part of health and how important it is to take care of it, not only when we are facing challenges, but also to maintain the overall well-being. Regarding the humanitarian context, I think MHPSS is very important as part of the preparedness, and not only as part of the response to build the resilience of the communities for future pandemic. I hope it will not happen, or any other critical event that will affect us. And we need to take care of everyone who is at risk, and COVID-19 taught us that we are all at risk. So it was a good lesson that prepare us to do better and do more. And we also understood how important it is to mainstream MHPSS, at least in this context. So we acknowledge that MHPSS should work across sectors like health, protection, site management, education, nutrition, just to mention some of them. Now, how should we continue? And of course, a lot of work needs to be done. We should keep advocating. As Fahmi also said, we need to keep advocating for funds to everyone, governments, agencies, other donors. We need more sustainable funding, and also in the long term. I also think that research can help in this by providing proofs that MHPSS services have indeed a positive impact and they are efficient. We can also include MHPSS in the essential services packages, as other panelists suggested as well. Maintaining remote modalities of support from now on is very important. I don't know if we will be able to go back to traditional modes of support, and I think we should not. We should keep both ways, remote are necessary. Ensure that everyone has access. It means to provide free services or minimizing the cost. So what Rania was saying, that in Lebanon, they are very expensive and not everyone has access. So it's something that we should all work towards this. Providing multi-layer MHPSS support is something else that comes into my mind, and not only specialized. Unfortunately, in some context, the focus is on psychotherapy, psychiatric support, and not on other layers of support. I think we should keep all talking about the importance of mental health as part of the overall health. It's not something separated. It's really part of our health. Over to you, Alicia.
Thank you so much, Stella. We have one final question, and then I'm going to turn to each panelist just to give us a final takeaway. The question we've come through from Asma Humanitarian, from a psychiatrist from Pakistan. We're getting a question is, how do we improve the policies that are being developed at the headquarters to actually be implemented on the ground? There's a challenge around this. I'm going to throw to Zainab and Milena. Would love to hear your thoughts on this. How do we make this practical and actually get that funding and the services happening on the ground where they're needed?
Thank you so much, Alicia. Asma, that's a very, very difficult question, but very real and very important. So if I understand your question correctly, you're asking about, how do we ensure that, HQ is supporting countries more intentionally. And I agree. I'm looking at your comment. There's a big focus on reporting and seeing results, whereas we're not really seeing the work on the ground and what support is provided. Maybe I'd like to try to respond to it through kind of a system change lens. Ultimately, I think the way in which we need to reconfigure the way in which humanitarian agencies support countries is by being more intentional in providing staff care. I think when we talk about MHPSS, we know that the main resource in mental health in MHPSS is the people. And I think there is not enough attention given to prioritizing workforce development globally, and the role that we play in headquarters in ensuring that the resources are mobilized, that advocacy is done with donors, with those people who are supporting responses, to ensure that we are working and partnering up with implementing organizations, with universities and governments to build up professional training programs and ensure ongoing training and supervision is provided for effective competency development in mental health workers. I also think that we need to be more intentional in supporting systems of care. So really strengthening referral mechanisms, data management. We know that the data piece is huge. And the reason why sometimes it's quite burdensome on countries to produce those reports and those materials that donors often ask for is because the data just isn't there. And we really need to be focusing our attention and mobilizing resources and investing our energy in creating those tools to support data, to also support quality assurance and coordination across sectors. And so I think those our ability to support and develop those tools for countries, I think is going to be really critical moving forward. And then finally, perhaps something important to mention is we talked a lot about where we're at and how the improvement that we've seen in MHPSS and the awareness. We finally seen that the plates have started to shift. People like me who have been in this field for over 15 years, we've been sounding the alarms for a long time. But now the world is finally listening. Sadly, MHPSS is still underfunded. So what can we do to better that situation, and how can we support countries? And that is why, as opposed to really focusing solely on the global level, we really need to be looking at governance and leadership at the country level. And this needs to include, mental health financing work with governments and prioritization exercises to ensure sustainability of MHPSS services, at that level. So really, it's all about building up and developing countries' capacity to take this work forward versus that top-down approach that you are very clearly articulating, Asma. Hope that answers your question, and back to you, Alicia.
That was very helpful. Milena, would you have anything to add there? I feel like you're very comprehensive, Zainab, but over to you, Milena, to add.
Maybe shortly to Asma. I love the question. I think more than a question, I'll take it as, if I can say, a suggestion or something for us to take with us. Because, just listening to Zainab, you will agree with me on this, Zainab. It's like, with all the description of the things that you said, this is exactly what it's happening for our teams, right? Is that they have to do all this, right? So you have to do monitoring and evidence collection and research, and you also have to do capacity building, and so a lot of the things we are discussing here today actually end up being the duty of teams that are sometimes very small. So I think that Asma's question is very realistic, and I take it as provocative, and I like that. It's a good suggestion for us to take home and think, in fact, that we are very ambitious. We have an ambitious agenda. And of course, we need always to think about our teams and what we are asking of them. But I fully agree that I think the solution to this is on one hand, that managers are like us trying to think and reflect on how to do better. So I thank you for that, Asma. And on the other hand, I think it's also about, what I mentioned before, which is that regardless of the wonderful strategies we have, I think working with the people themselves, many of the activities that we do, for many of the things that we do, is also an incredible resource and can provide to the teams in the field, not only the satisfaction that they're doing something practical, but this feeling that you don't have to do it all. If you have a good connection with many people in the community that you're helping, you have a good network, you improve coordination that we have talked so much about, this multi-sectoral work and working together. So I think it's also about that. And I think our teams are also learning. This is the capacity building, Asma, learning how to not get absorbed by all of these and prioritize what's really important. But thank you so much for this.
Thank you so much. Okay, we're almost out of time. I'm going to give our panelists one sentence response to wrap up, so one kind of comment, one sentence to take away. What's a top line message you've heard today that really stands out to you? First, let's go to Stella.
Yes, thank you, Alicia. Since I work in Bangladesh, I will say that we need more advocacy for funds. After an emergency, the needs are still there. and funds or services should not disappear after the peak of the emergency. And it's something that we see. We have crises that are very well known, and we have, in parallel, we have silent crises like the Rohingya one. So I think we need to keep advocating for more funds. Thank you.
Keep advocating funds. I love that. I know Rania had to step away. Milena, one takeaway from you?
I would like to say that let's don't forget that there is a lot of resilience as well, witnessed every day. So it's good that we talk about these problems, but communities are definitely not broken. The witnessing, the bravery of people should be acknowledged. And we believe that, you know, only by building upon this resilience, we can actually do more. So we need to approach also the communities and individuals with this and tackle head on the fragilities of humanitarian context with the multi-sectoral approach, I think.
Love that multi-sectoral approach. It's definitely coming through. And Zainab.
Thank you, Alicia. In the spirit of some of the questions that have been asked, I would say, let's not forget that, you know, humanitarian crises have long-lasting impacts on mental health and psychosocial well-being. So it's really essential to build back better systems and services in our approach.
Wonderful. Thank you all so much for a very substantive, sometimes provocative as it should be, and very practical conversation today. The purpose of this event was to look beyond 2022, beyond this week. And I think we've given some very, very practical ways in which to do that. Just to sum up a couple of key points, I won't be able to cover everything here. There was a really powerful quote to say, not all wounds are visible. And that is something that can keep us driving forward and remembering, although we may not see these, they're very real, not only, as Zainab, you just said, not only during a crisis, but in a prolonged way. Very, very strong, wonderful quote from Carmen actually brought in this proposal. Let's not debate this anymore. Mhps, especially in humanitarian settings, is essential and life-saving. It's very clear this needs to happen. We've had some very practical examples of the how. A couple of points I want to pull out: it needs to be integrated into humanitarian responses as well as UHC health systems. That multi-sectoral approach keeps coming through. We've heard from climate right through to a range of others, gender, equity, a whole range. This needs to be multi-sectoral. We heard it from Mhps as well in the conflict solutions themselves. This needs to be community-led, those with lived experience in the community, especially those also at the front line. And we can't forget them. And context specific. Most importantly, we've got some very practical examples. The MSP, really practical, helpful, we've heard through. There's been reference of the WHO Comprehensive Action Plan, preparedness indicators, the reference group, and ways to convene. Finally, I think that the Red Cross and Red Crescent movement solution was a really good example of tangible commitments made together by states and agencies together. We've got a really clear call from Mexico and a call for many colleagues to come together around UNGA, around that call and resolution, and a mental health summit happening in Italy in October. And there is all opportunities to bring these messages together. Finally, I'd just like to, in this last minute, thank our sponsors, the government of Morocco, the government of Mexico, the Kingdom of Morocco, and the Kingdom of the Netherlands, alongside ICRC, IFRC, OCHA, Save the Children, UNICEF, and WHO. Thank you all for hosting this very important conversation, for all the work we're doing. Let's take this forward, and we'll see this work continue. And just a final point, that comment from Mexico, we have an opportunity coming up in September. Let's come together and see this move forward. As we finally heard from Pakistan, not just in conversations, but let's make sure we translate it into action where it's needed most on the ground. Thank you all for your time today, and we look forward to seeing you all again soon.
Thank you, Alicia.
Thank you all.
Thank you very much.
Thank you, everyone.